When should I see an orthopedist? You should consider seeing an orthopedist if you are experiencing any musculoskeletal issues, pain, or mobility problems that are affecting your quality of life. Orthopedists specialize in diagnosing and treating a wide range of conditions related to bones, muscles, joints, and other connective tissues. Here are some situations when you might want to consult an orthopedist. 1. Persistent pain. If you have been experiencing persistent pain in your bones, muscles, joints, or back that doesn't improve with rest or over-the-counter pain medications, it's a good idea to see an orthopedist. They can help identify the source of the pain and recommend appropriate treatment. 2. Limited mobility. If you're finding it difficult to move a joint, limb, or body part, or if you've noticed a decrease in your overall mobility and range of motion, an orthopedist can assess the issue and recommend appropriate therapies. 3. Injuries. If you've suffered a traumatic injury such as a fracture, dislocation, sprain, or tear in a ligament, tendon, or muscle, an orthopedist can provide proper evaluation, imaging, and treatment options to ensure proper healing and rehabilitation. 4. Joint problems. If you're experiencing ongoing joint pain, stiffness, swelling, or instability, especially in major joints like the hips, knees, shoulders, or ankles, an orthopedist can determine the cause and develop a treatment plan. 5. Arthritis. If you've been diagnosed with arthritis or suspect you may have arthritis due to joint pain, swelling, and stiffness, an orthopedist can help manage the condition and recommend appropriate treatments to alleviate symptoms. 6. Sports injuries. If you're an athlete or engage in physical activities and have sustained a sports-related injury, an orthopedist with expertise in sports medicine can provide specialized care to help you recover and prevent future injuries. 7. Back or neck pain. If you're experiencing persistent back or neck pain, numbness, tingling, or weakness in the extremities, an orthopedic spine specialist can evaluate your condition and recommend appropriate treatments. 8. Deformities. If you have noticed deformities in your bones or joints, such as scoliosis, curvature of the spine, limb length discrepancies, or other structural issues, an orthopedist can assess the condition and discuss potential treatment options. 9. Recurring pain. If you've had a previous orthopedic injury or surgery and are experiencing recurring pain, discomfort, or complications, it's important to consult an orthopedist for proper evaluation and management. 10. Preventive care. You can also see an orthopedist for preventive care, especially if you're at risk for certain musculoskeletal conditions due to factors like family history, lifestyle, or occupation. They can provide guidance on maintaining musculoskeletal health and preventing injuries. Remember that early intervention and proper diagnosis are crucial for managing orthopedic issues effectively. What should I expect during my first appointment? During your first appointment with an orthopedist, you can expect a comprehensive evaluation of your musculoskeletal condition. Here's what you can generally expect during the appointment. 1. Medical history discussion. The orthopedist will start by asking you about your medical history, including any previous injuries, surgeries, medical conditions, medications you're taking, and your family medical history. Be prepared to provide detailed information about your symptoms, including when they started, their severity, and any factors that make them better or worse. 2. Physical examination. The orthopedist will perform a thorough physical examination of the area causing you concern. They may assess your range of motion, strength, stability, and any specific movements that trigger pain or discomfort. The examination may involve palpation, touching and pressing on specific areas, joint assessments, and other tests to evaluate your musculoskeletal function. Imaging studies. Depending on your condition, the orthopedist may order imaging studies such as X-rays, MRI scans, or CT scans to get a clearer picture of the affected area. These images can help diagnose underlying issues like fractures, ligament tears, or joint abnormalities. 3. Diagnosis. Based on the information gathered from your medical history, physical examination, and any imaging studies, the orthopedist will provide you with a diagnosis. They will explain the nature of your condition, its likely causes, and the potential treatment options. 4. Treatment recommendations. The orthopedist will discuss the recommended treatment options for your condition. This may include both non-surgical approaches, such as physical therapy, medications, bracing, and injections, and surgical options if necessary. They will explain the benefits and risks of each treatment option, as well as the expected outcomes. 5. Discussion and questions. This appointment is an opportunity for you to ask questions and discuss any concerns you may have. Feel free to ask about the proposed treatment plan, potential alternatives, recovery times, and any other questions you may have. 6. Next steps. Depending on your diagnosis and treatment plan, the orthopedist will discuss the next steps. This might involve scheduling follow-up appointments, starting a course of treatment, undergoing further tests, or preparing for surgery if needed. 7. Additional referrals. If your condition requires expertise beyond orthopedics, the orthopedist may refer you to other specialists such as physical therapists, pain management specialists, or surgeons from different specialties. Remember to bring any relevant medical records, imaging results, and a list of your current medications to the appointment. Being well prepared and providing accurate information will help the orthopedist make an informed diagnosis and develop an appropriate treatment plan tailored to your needs. If you have any concerns or questions during the appointment, don't hesitate to ask for clarification or further explanation. Surgery. If I'm seeing an orthopedic surgeon, does it mean I'll end up having surgery? No, seeing an orthopedic surgeon does not necessarily mean that you'll end up having surgery. Orthopedic surgeons are trained to diagnose and treat a wide range of musculoskeletal conditions, and their expertise extends beyond surgical interventions. In fact, many orthopedic conditions can be effectively managed with non-surgical approaches. The decision to recommend surgery or non-surgical treatment depends on various factors, including the nature and severity of your condition, your overall health, your preferences, and the potential benefits and risks of each option. Here are a few important points to consider. 1. Comprehensive evaluation. During your initial consultation, the orthopedic surgeon will thoroughly assess your condition through a combination of medical history, physical examination, and any necessary imaging studies. Based on this evaluation, they will discuss the most appropriate treatment options for your specific situation. 2. Non-surgical options. Orthopedic surgeons often begin with conservative or non-surgical treatments whenever possible. These may include physical therapy, medications, injections, such as corticosteroids or viscose supplementation, bracing, and lifestyle modifications. Many patients experience significant improvement with these approaches. 3. Informed decision-making. Your orthopedic surgeon will provide you with a clear explanation of your diagnosis, the available treatment options, and the potential outcomes of each option. They will take into account your preferences, lifestyle, and goals to help you make an informed decision about your treatment plan. 4. Surgical consideration. If your condition does require surgical intervention, your orthopedic surgeon will explain the reasons behind this recommendation and provide details about the procedure, potential risks, benefits, and expected recovery process. They will also discuss alternative non-surgical treatments if applicable. 5. Second opinions. If you're uncertain about a recommended treatment plan, you have the right to seek a second opinion from another orthopedic surgeon or a medical professional. Second opinions can help you gain a better understanding of your condition and available options. Remember that orthopedic surgeons are dedicated to providing the most appropriate and effective care for their patients. Their goal is to help you achieve the best possible outcome, whether that involves non-surgical treatments, surgical intervention, or a combination of both. Ultimately, the decision about whether or not to have surgery will be a collaborative one between you and your orthopedic surgeon, based on your unique circumstances and treatment goals.